There's two sick patients with chest pain. Which one do you see first, and why? Write it in the comment section. You're working as an A&E doctor. The first nurse bleeps you about Ngolo. He's a 23-year-old male gentleman who's been unwell for the last 3 or 4 days. He initially started with a cough and a mild temperature. He thought it was a viral infection but continued to study. The nurse tells you that he's initially from Eastern Africa but has come over for university. This evening he's been brought in by his friends because he's less responsive. He looks a little bit more drowsy and isn't well. His friends say that he was complaining of pains in the hands and the arms. This was incredibly severe and they've double checked and he's not had a fall or injured himself. Over the last day or so he was also very breathless. He was struggling to go up the stairs, so he decided to sleep on the sofa yesterday. The nurse is worried because his oxygen levels are starting to increase. The patient is starting to hold his chest and is experiencing severe chest pains. His friends weren't too sure, but they mentioned that he's always said he's short for his age and he once had gallstones early on in his life that needed an operation because his skin went yellow. Just as you're about to go see him, a second bleep comes in. Charlie's a 28-year-old male patient who had a viral infection 2 or 3 weeks ago. He initially had a cough, breathlessness and was bringing up some phlegm. He went to the GPs and was reassured. Without antibiotics he's got better, but today he started to experience central chest pain. The nurse tells you it's on the right side between the breastbone and the rib. When that area is pressed, the pain gets worse and worse and he's crying out, needing help. So, 2 patients with chest pain. Tell me, what are the 2 diagnoses? Which one do you see first and why? I'll share my thoughts in 24 hours.